Gregory Substance Use Disorder and Alcohol Intoxication Protocol. Gregory may have alcohol on special occasions, though not recommended. Staff will have to call 911 if he has more than one drink. Gregory will be observed for any symptoms of intoxication. Symptoms of intoxication include changes in speech, for example, slurred speech, speaking loudly, using foul language. Changes in coordination, for example, impaired balance, impaired ability to stand, staggering. Changes in behavior, overly friendly, speaking loudly, bragging, overly excited, erratic, agitated, unpredictable behavior or aggression. Changes in cognition, impaired attention or concentration, unable to follow directions, loss of train of thought, reduced judgment, or confusion. Change in vision, dilate pupils, red eyes, drooping eyelids, unable to focus or see clearly, or closes and covers one eye to remove double vision. Changes in the person's usual manner and appearance, smell of alcohol and breath, strong stale odor of alcohol, soiled or disheveled clothing, sweating, unusual or new behavior, not characteristic of the person, any other physical or behavior changes that might indicate that an intoxicating substance has been used. The treatment plan, program staff will notify the program manager if Gregory consumes one drink. Staff will notify the on-call nurse if Gregory consumes two drinks. If possible, staff will obtain details from the person served as to the type and amount of substance used. Take a set of vital signs if she can. If resident permits, pulse should range between 60 to 96 beats per minute. Blood pressure top number should not be no higher than 140, no lower than 90. The blood pressure bottom number should be no higher than 90, no lower than 60. Staff should observe the person's physical and behavior status every 15 minutes for the first 2 hours in a comfortable space for the person served, and update the RN after 2 hours or as needed. If the person served goes to sleep during this period, staff will monitor the person at least every 30 minutes or at intervals advised by the on-call nurse for changes in breathing, seizure activity, and or vomiting. Staff will check regularly to ensure the person responds to being stirred. Staff will say their name loudly, ask them firmly to open their eyes, prod them, and look for a response. Staff should also watch the chest or abdomen for breathing movements. A breathing rate of 12 to 20 breaths per minute at rest is normal. If the person served is lying down and begins to vomit, place him or her in a recovery position on his or her side with the higher knees bent to prevent choking. Put something behind his or her back to prevent rolling back onto the back or stomach. If the resident should fall, call 911 so they may be examined by a practitioner. Under the influence of a substance, injuries may not be apparent. Protocol for dysphagia. Treatment plan. Individual symptoms of dysphagia include coughing and choking. Staff will work with Gregory to improve his dysphagia by encouraging him to consume his regular consistency diet with nectar thick liquids as ordered, cut up all meals, small portions, and extra gravy, encouraging him to eat slowly, encouraging him not to talk while he's eating, sitting at a 90-degree angle for all meals and for at least 45 degrees for 30 minutes after meals. Staff will monitor for signs and symptoms of choking, such as coughing, excessive saliva, or clenching of the throat. Staff will monitor for trouble breathing. Staff will monitor for chest pain. Staff will monitor for increased temperature. Staff will have to call 911 for chest pain, difficulty breathing, altered mental status or extreme change in behavioral level of consciousness, blue lips, pale or gray skin, or other signs of decreased oxygen, lethargy, and unconsciousness. Staff responsibilities are 1. Supervise Gregory at all meals. 2. Call 911 for any of the above symptoms that we have mentioned in the past. 3. Notify the house manager, nurse, and MD if choking occurs and or if 911 is called. The texture of the liquid an individual receives is recommended by the occupational therapist or speech therapist and is ordered by a doctor. The texture should not be thinner than the prescribed consistency. So for Gregory, he has the nectar, which is the apricot or tomato juice consistency. Some liquids may require a thickening agent to reach this consistency. This is a texture data recording form, probably upside down, that the staff have to complete. The one-on-one, Greg has a one-on-one protocol and interactive guideline. Being a one-on-one staff is an important responsibility which must be taken very seriously. Greg is assigned a one-on-one staffing due to the behavioral problems, which may impact his safety and safety of others. Greg requires assistance of safely transition to and from his wheelchair, as well as navigate his home and community settings safely. All staff assigned as a one-on-one monitor are ultimately held accountable for the well-being of Greg while assigned on their shift. All staff must sign their name and date of the shift one-on-one log as being Greg's assigned one-on-one at the beginning of their shift and every hour thereafter during their shift. Their signature indicates that they have had their eyes on Greg at all times during each hour of their shift. All staff must remain in visual view of Greg at all times throughout their shift, with the following exemptions: when Greg is napping or requests privacy, or when Greg is sleeping during Greg's typical asleep hours. In these situations, staff must be seated outside of Greg's bedroom, out of view, and visually check in on Greg every 15 minutes. Staff must report any incidents of challenging behavior or of other concern to the chain of command before their shift is over and complete proper paperwork. Residential bathroom use for the individual. If Greg wishes to use the bathroom or is taking a shower, staff must provide one-on-one assistance as needed for thoroughness and safety. If Greg requests privacy while using the bathroom, staff will remain outside the bathroom door and check in every 5 minutes. For meals, television, main living room areas, when Greg is eating, watching TV, or hanging out in the general area of his home, staff must be situated close by. During dinner, staff are to be seated at the table while Greg's watching television. Staff are to be seated in the living room couch when Greg is outside on the porch. Staff are to be seated within 12 to 15 feet. In the community, when Greg is in the community, staff must remain within 6 feet of him at all times. If there's smoking breaks for staff, staff must have another staff take over one-on-one responsibility if they desire to smoke. If staff cannot switch off with another staff, they are not to smoke.